Hello everyone. So this video is to explain the process behind doing PRP for hair loss. Many people think doing PRP will help them to reverse baldness. Let me tell you, that is not true. Baldness will not get reversed using PRP treatment. PRP is usually used to control hair loss, improve the quality or the thickness of the hair, help resting hairs to enter into the growth phase if someone has lot of resting hairs. So the basic principle is, let's say each of us, when we have an injury, we go to a physician and we get the wound sutured. We remove the stitches over the next 10 days, 8 to 10 days usually. But when you remove the stitches, the skin appears to be united. This process of repair is usually done by a cell in our body called platelets. So PRP is nothing but our plasma rich in platelets. So first of all, remember, for your PRP to be effective, your plasma has to be rich in platelets. So if PRP is done on someone whose platelet count is very low, the result may not be good. Most of the time we do or we advise PRP for men and women who have excessive hair loss, that is in the early stages, that is beginning of baldness and hair thinning, and when there is a diffuse loss of density. PRP is usually done once a month, and our protocol is done for 3 consecutive months. We also add some growth factors during the PRP injection. So the about 20 ml of blood is taken from the patient, and this is taken by a sterile technique in containers which are specifically designed for this procedure, and the blood is centrifuged and the platelet-rich plasma separated, which is then aspirated and then injected. Before injecting onto scalp, we initially apply some numbing cream, but that's not sufficient if we want to inject it in the right depth. So we also give a local anesthesia block. PRP is, along with the growth factor, is injected subdermally, which means we just below the upper layer of the skin in order to facilitate regrowth. Again, I would like to reiterate, PRP technique is not used to reverse baldness. It is used to control hair loss because PRP by various studies have also proven to have mechanisms to block 5-alpha reductase, and it also provides growth factors. Please remember that for a successful result of PRP, it's not enough if you do this as a standalone procedures. You need supplementary medication to facilitate growth of the hair if a sleeping hair is pushed into the growth phase, and you may also be prescribed medication to block 5-alpha reductase if the condition is diagnosed to be androgenic alopecia. Thank you.